Now, tonight we are honored to have a distinguished guest all the way from the United Kingdom. Now, this esteemed lady will be presenting the prestigious SLAUS lecture. To introduce our guest, I would like to invite the President of the Sri Lanka Association of Urological Surgeons, Dr. Manjula Wijewardena.
Members of the head table, past presidents, Council of SLAUS, ladies and gentlemen. Tonight's SLAUS lecturer is Dr. Jo Cresswell. She is the reigning president of British Association of Urological Surgeons and its first female president. She was heading its section of oncology before ascending to the presidency. She graduated in medicine from University of Newcastle and received the PhD for her work in bladder cancer immunology. She is a consultant urological surgeon at James Cook University Hospital in Middlesbrough. She is an expert in bladder cancer management, including its radical cystectomy. She also served on Specialty Advisory Committee for Training in Urology and was the program director for urology training in North of England. Members of the head table, past presidents, Council of SLAUS, ladies and gentlemen, I present to you Dr. Jo Cresswell to deliver the SLAUS Lecture 2023.
Mr. President of SLAUS, thank you for that wonderful introduction. Mr. President of SLAUS, my fellow presidents, I never get bored of saying that, I'll tell you. It's such a pleasure to be here, ladies and gentlemen, and a huge honour to present the SLAUS Lecture on behalf of the British Association of Urological Surgeons. Now, those of you who are in the audience today for the academic sessions may have noticed that I've changed my outfit. I've ditched the orange suit, and my very good friend and colleague, Ms. Tarani Nitkinen, has loaned me one of her saris. Thank you, Tarani. It feels very special to present this lecture wearing this beautiful sari. Thank you. So, the title of my lecture is Global Urology, a View from a Small Island. Now, the island I am referring to is the United Kingdom, which is actually a small group of islands that lie about 20 miles from the coast of Europe, continental Europe. And I wrote this in my study in the north of England. However, having spent 2 days in Sri Lanka, I reflect that maybe everyone here is forming their own view of global urology, also from a small and very beautiful island. So I'm going to mention some themes that occur to me. I think there's been a lot of change in the world of urology, and I'm going to reflect some of those things, and maybe together over the next couple of days, these ideas will resonate. So, I dedicate this lecture to Dr. Kalana Parana Palea Guriga, who is the most tenacious, the most enthusiastic, and the most hard-working secretary of any urological society on the planet. He travelled to not one but 2 international congresses, and in my estimation, approximately 9,000 miles to invite his international guests. The WhatsApp messages. You must stop sending quite so many WhatsApp messages. The photograph here is of myself and Kalana. This is at the AUA in Chicago. My husband is in the picture. Just to avoid any confusion, the gentleman on the far left of your picture is actually the editor of the Indian Journal of Urology, Rajiv Kumar. He's not my husband. It's the gentleman on the other side, Paul, who is my husband, and he's wondering, why am I getting about 10 WhatsApp messages an hour for the last 2 weeks from Sri Lanka? The original brief for me was to talk about British contributions to global urology. However, my very strong message is slightly different. I think it's a two-way street. I feel allyship between us all is an exchange of ideas. that goes around the world and transfers between continents. But I will reflect a little bit on an association that I am immensely proud to lead, and that is the British Association of Urological Surgeons, which was formed in 1945, which was a time of great turmoil, a time of great change. This is the first president wearing a military uniform, because many, many doctors, of course, were in the military. And I just reflect that as the 40th British Association of Urological Surgeons takes over, we're in a century again of great change. The world is changing so fast that you blink and it's changed again. I do feel, however, that the motto of BAUS, that has lasted 78 years, I think it's just as important now as it was then. I won't tell you the Latin. I'm not a Latin scholar. United strength is stronger is a really important theme, and it comes across in all of the associations, that together the urological community is so much stronger. I want to pay homage to some of the giants of British urology that are shown here. There are many more. We stand on their shoulders, and I'm so, so proud to be part of a community of British urologists that is built on the work of these men and many others. However, I also want to reflect on very recent contributions that the British urological community has made. Many of these people are my friends, my mentors, and they have published research that has been practice changing in the last few years, and I'm very proud of that. I am particularly proud, very, very proud, immensely proud of our young trainees in the British urological community. They have produced some incredible collaborative projects that have been global in nature. It's the BURST community of urologists. This was not a group that was put together by people like me in leadership positions in urology. These young registrars in urology took the initiative, had the passion to build something absolutely spectacular without any influence, only some encouragement from their seniors. And what I really, really respect about them is how inclusive they are. People from around the world, registrars in every continent, contribute to their projects, and everyone has the opportunity to take that data and present it at any meeting. They are truly inclusive, and that I respect enormously. There are a number of contributors to this study, for example, who are from the SARC countries. In fact, the top contributor to the RESEC study was Dr. Sakthavel from Chennai. You will also see other contributors from India and from Pakistan. Something else I think that the British urological and surgical community in general is perhaps quite well known for is our educational programs, our curriculum. And I know that many associations have parallel programs that are very similar. I think we are also the exporters of probably the most expensive tie in the world. It will cost you approximately £2,000 minimum to obtain this tie from the Royal College of Surgeons of England, and there are plenty of them out there. For the few ladies who also hold the FRCS, we get an attractive brooch that also costs £2,000. I'd like to pay homage to the international colleagues who are hugely important to British urology and also to the NHS at large. We have a hugely diverse community of doctors and nurses, all clinicians in the NHS. The International British Urology Society is a very vibrant and very active society in the United Kingdom. And I think what pleases me the most is in the last few years, IBUS, the International Society, and BAUS have come together as an organisation like never before. And I'm very, very proud that my friends and colleagues, Mr. Joe Phillip and Mr. Shabi Ahmed, both graduates from SARC countries, are now on the board of trustees of BAUS, and it won't be very long before we have a president also from this area. I want to recognise the giants of urology from the South region. This is Dr. Rajiv TP, and it was my immense privilege to present him with our highest award, the St. Paul's Medal, in BAUS 2023. You will see there are other names from the South region who have also been awarded this highest award. This is not given lightly, this medal. It is enormously important to our association, and it is a great honour that these colleagues have been awarded this medal. 2 weeks ago, I chaired the Medals Committee for 2024. A huge privilege for the President, and I was joined by 10 colleagues from across the organisation. In June 2024, it will be my immense privilege, and probably one of my final acts as the BAUS President, to present this medal to Dr. Kulkarni. The other highest award that BAUS can endow is the St. Peter's Medal. This is also going to a graduate from a SARC country. My friend Professor Shamim Khan will receive the St. Peter's Medal. I think at the moment, BAUS Urology is looking very widely around the globe. It is so important to us, our global links. And 2 other medals that I'll be giving out next year are special for 2 reasons. One, they both represent contributions to global urology. Jean MacDonald, a graduate of medicine in Jamaica, has got the gold medal, and this is reflecting much of her work, particularly in West Africa. And Susie Venn, who is the chair of Eurolink, which has done an enormous amount of work, she is receiving the John Anderson Award. The other reason I'm very proud of this is showing the prominence of female leadership in BAUS in the UK, and there are many incredible female role models now who over the last 10 years are really coming into prominence in our association. I want to recognise some things that I've thought of just in the last few days, in fact, which are the opportunities for BAUS to learn from SLAUS. There are many opportunities for that exchange of ideas, that allyship, that two-way street I mentioned. But 2 things I've thought about particularly. One is that Sri Lanka and the UK both have a national health service, both funded by general taxation. And yet, in a high-income country like the United Kingdom, we manage to waste a huge amount of resource, whether that be time, or whether that be disposables or equipment. We are a very wasteful community, staff and patients. We've forgotten what it was like not to have an NHS. And I think we can learn from an NHS in another country about how to be so much more productive and so much more efficient while utilising less. And this is absolutely crucial because we are committed to driving down the carbon footprint of healthcare services, which in surgery is particularly high. The other area we've reflected on together, I think, is that whilst UK trainees are becoming proficient in laparoscopic surgery, in robotic surgery, in all types of endoscopic and minimally invasive surgery, there is not much exposure to open surgical procedures, and a lot of new consultants in the UK are worried about this when they get called to an emergency that requires open surgical skills. We have been de-skilled, and I think there is a great opportunity for exchange of skills and ideas. Sri Lanka and the UK have a long and intertwined history with so many aspects that are so positive. Our friendships, our shared interests, many of our institutions are very similar. The allyship, the research and education opportunity. I think, however, it would probably be disingenuous of me not to at least acknowledge somewhat that there have been negative influences, and they continue to be some negative influences. Much of this is based on privilege, which is not just economic. And I think together we reflect on a changing world, and this is no longer acceptable, and together we can work to eliminate some of those negatives, which, from where I'm standing, create great imbalance and inequity. I know that when I stand in Sri Lanka, I stand in a country which has embraced female leadership way before many other countries around the world ever did. I landed at Bandaranaike Airport, and I know this was the first female Prime Minister, in the world. And there are many SARC countries, and the UK have followed suit, and we've had female leaders. And it is my great privilege to be the first female president of BAUS. What I will say is this: that is not a judgment about having a female president. It is a barometer of where our association is. It is a barometer of the open minds and the diversity of thinking that is embedded in British urology. There are over 2,000 members of BAUS. Less than 200 of them are female. There is no way those women can elect a female president unless the whole organisation is being progressive and forward-thinking, and that is something I am convinced we are seeing in British urology right now. This is BAUS Council. It looks diverse. We have a wide range of age groups and experience, of different backgrounds, of different educations, different languages. It is diverse in appearance, but it is also very diverse in thinking. And I'm very, very proud to represent an association that is doing that so actively. So, united strength is stronger. I think that still stands. I notice that the mottos of many associations talk about strengthening together and being a community. I was particularly pleased to see, when I was at BAUS, the slogan for that meeting: regional problems, regional solutions. When we look to learn from each other, yes, we learn, but we also adapt to our particular situation, because the way that I work in Middlesbrough is different to the way that colleagues work in other areas. So we exchange, we take what works for us, and we adapt. I'm going to finish with a quote by an American president. "We are defined not by our borders, but by our bonds." I celebrate the differences in all our cultures. I'm wearing a sari because I celebrate the culture of Sri Lanka and of South Asia, and it is an enormous and exciting privilege to be able to engage by wearing this. But I also know that we aren't defined by those differences, but by our very strong community of urologists. And each meeting that I attend around the world brings that home to me more and more. It has been my immense privilege to give this very important lecture. It is my immense privilege to represent British urology, and I'd like to thank you all for the very, very warm welcome that you have given me and my colleagues. I hope you have a wonderful evening, and I look forward to the academic contributions at the rest of the conference tomorrow. I thank you.